I work as an assistant professor in psychology at Michigan State University in the U.S. My primary area of research is looking at how underpinnings of emotion, cognition, and the regulation of emotion and cognition are involved in anxiety and anxiety disorders, so that we can understand better how to assess and understand how anxiety works and develops, as well as how we can better treat anxiety with novel targeted interventions at specific cognitive and emotional mechanisms. The big questions in my field, I'd say, are really how is it that we can use basic neuroscience findings, these ideas of brain activity being different between anxious and non-anxious people, to actually inform how we assess people differently and treat people differently in the clinic. And I think that's what we grapple with, trying to translate between what we're doing in the lab and finding these differences, and how we're actually going to use that information to make better clinical decisions about what disorders or what problems people are struggling with, as well as how to then intervene, because at the end of the day, we're really interested in how we can make people's distress reduced, but also how we can get them functioning better in their lives. So we have to really understand how is it that we're going to translate that. So in the work that we do, we really have to focus in on not just finding differences between anxiety and non-anxious patients or individuals, but then how can we translate that into the clinic and say, all right, we have to look at this different way of assessing anxiety that we can look at in the brain, and then develop a treatment that will specifically target that and actually make improvements in people's lives.